So to start off with, what is a disease? Disease is an abnormal normality of structure or function or part of an organ or system. Diseases can be either you can know where they came from or possibly not know where they came from. They can also be severe or not severe, and we're going to talk a little bit about that. Diseases fall generally in 7 categories: infection, degenerative disorders, nutritional disorders, metabolic disorders, immune disorders, neoplasms, and psychiatric disorders. We're going to talk about a little bit of each of those. Infection. Infectious organisms are those that are believed to play a part in at least most of half of all human illnesses. Picture here, of course, demonstrates that it's really important about how important hand washing is, because that is one of the number one ways to stop the spread of infection. Degenerative disorders involve where a body system or part of the body is somehow breaking down. Examples of these are Alzheimer's, muscular dystrophy, and osteoporosis, although there are many others. The picture on the left shows a picture of a healthy brain and one with advanced Alzheimer's, so you can see the degenerative breakdown in that. The middle picture is a picture of a normal person and one who has muscular dystrophy. And the third picture is one that shows progression of osteoporosis. Nutritional disorders are those caused usually by a deficiency or excessive intake of certain food items or vitamins or things like that, or minerals. Examples are scurvy. Picture of the pirate on the right kind of gives you what a manifestation of scurvy looks like. It affects the gums and bleeding gums, and then, of course, eventual loss of teeth. And if you remember that it was discovered in medical history that limes prevented scurvy, of course, it was vitamin C in the limes that did that. Rickets is another example where you have lack of calcium for bone development. You would see this in children that are malnourished. It creates a situation where the bones don't harden and become softened, and it would create things like bow legs or abnormal curvature of the spine. Other examples are alcoholism and obesity. Um, if you look at the picture on the right, it's a progression of what can happen to people related to nutritional disorders around eating. To the far left is anorexia nervosa, towards bulimia nervosa, and then, of course, total obesity on the right. Metabolic disorders are caused by a disruption of reactions that are involved in cellular metabolism. Remember, everything happens in your body on a cellular level. Examples of metabolic disorders would be diabetes, various digestive disorders, and gout. Gout has to do with the breakdown of uric acid. Picture at the top would be a diabetic who have to check their blood sugar daily or throughout the day to try to maintain that. And picture at the bottom is an example of what happens with buildup of uric acid crystals. If you can't break down uric acid, it crystallizes inside your body, and it tends to locate itself in joints, as in the picture. Okay, immune disorders. In these is where the body tends to lose its ability to fight infection or fight against certain things. There can be autoimmune, which is where the body tends to attack itself, like in multiple sclerosis. Also in overactive immune systems, you can have that as well. That is also immune disorder, which would be allergies, where a certain stimulus sets off an allergic response. HIV causes a person to develop acquired immune deficiency syndrome. Hence, the disease says what it is. It is an immune deficiency, makes a person susceptible to more things, like Kaposi sarcoma, for example. The picture on the right shows mentions a few different other types of autoimmune disorders, just as a point of information. Neoplasms, which, if you remember from medical terminology, means new growth. That can involve things like cancers or tumors. Two pictures here. One is the progression of polyps to possible colon cancer, where it can lead to that, and hence it's a new growth in the colon. On the right, of course, that's a new growth some type of tumor or growth on a person's eye. Psychiatric disorders are also known as mental disorders, and a lot of times these go hand in hand with different types of physical disorders that we've already mentioned. If you look at this picture of words, this gives you some of the connections of, and you should look through it to see what can cause possible psychiatric disorders or mental disorders. Kind of gives you some, helps you see the relationship between diseases, disorders, and how it can manifest itself in a person as far as psychiatrically. Okay, predisposing causes are factors that can contribute to disease developing at all. Things that can cause a person to develop a disease are things like your age. So certain people at certain ages are more susceptible to certain diseases, whether you're male or female. Your heredity. You are many times governed by your heredity. The conditions that you live in. Emotional disturbances, chemical and physical damage, or pre-existing illnesses. This is a picture of sinusitis. People tend to have a certain predisposition to this. It can be hereditary. If sinus issues tend to run in your family, you can develop it. Picture on the far right shows what a normal sinus looks like and people with sinusitis. So that kind of gives you an idea of an example of one of those. The way we study and treat diseases usually refers to a couple things. One, you always have to look at the pathophysiology, which is the relationship between the physiological and pathological aspects of a disorder in order to understand treatment options. This is where chemistry and physics fit into the whole healthcare program of study, because chemistry and physics are the building blocks of everything in medical science. Everything happens on a cellular level and is a chemical reaction. Etiology is the study of a cause of disease, and usually the incidence is typically determined. In other words, who does this disease affect? Who does diabetes affect? Who tends to have heart disease? Those are all things that fall under etiology. Diseases are classified as either acute, chronic, or subacute. Acute means that they usually last for a long time and short time and can be severe. Example of acute would be a picture of the baby where it shows progression. The disease, the fever starts at 105 and then drops, and then the fever's gone and develops a rash. That's a good example of an acute episode of a disease. Chronic is something that's less severe but longer lasting and can reoccur. It can also be subacute. Subacute refers to it's not as severe as if you have an acute episode. However, it's present for a shorter amount of time than a chronic disease. Picture at the top shows a chronic condition, which is atherosclerosis in a coronary artery, which can lead to an acute condition, which would then be a heart attack. So sometimes they chronic and acute can overlap. Disease terminology. Some terms around diseases are things like idiopathic, which means it's self-originating from medical terminology, meaning you don't know really where it came from, so you call it idiopathic. Communicable diseases are ones that are spread from person to person. Epidemic, of course, refers to people in a region that acquire the disease at the same time like the flu. Flu is one of those things that can be an epidemic. Endemic is found less abundantly, but occurs continuously in a region. Let's say if you lived in an area where a certain mosquito carried malaria, then malaria would be endemic to that area. Pandemic is a disease that's present over a large region. So if you think back to the history of medicine, you would remember the plague. The plague was one that was a pandemic and spread across Europe and Asia. Treatment. The way we treat things is usually based on a physician using clues from the patient's signs and symptoms to diagnose an illness. That's why a history of person's medical history is really important, and being able to take one is also very important. A syndrome is a group of signs and symptoms that accompanies a particular disease. Acquired immune deficiency syndrome. Prognosis is the prediction of the outcome of a disease based on evidence and knowledge. Based on what you know about this disease, you can predict a prognosis. Therapy is the prescribed course of treatment. Ways to stop diseases. The best thing to do is try to stop disease before it occurs. This is a relatively new concept to disease, new meaning in the last couple hundred years. You treat the patient in order to avoid illness, the promotion of a healthy lifestyle. Uh, Agencies that work towards this on a global level will be the World Health Organization, and nationally here in the U.S. is the Centers for Disease Control and Prevention. Infectious diseases are, just to kind of get into what they're caused by, are caused by microorganisms. Of course, micro means small, organism is anything that has life, and not all microorganisms are bad. Parasites, or an organism that lives in or on a host at the host's expense. Pathogen are those microorganisms that cause illnesses. Infection is when your body's invaded by a pathogen and causes a negative effect. In a localized infection, that would be maybe a cut that's gotten infected. That would affect a small part of your body. A systemic would be where the whole body or a large part of the body is infected. Opportunistic infections are those that are acquired when the immune system's depressed. So people who have an immune deficiency, they may be more susceptible than other people don't. Also, sometimes people, when they're stressed, it weakens their immune system. Hence, it is easier to catch a cold when you're stressed. Ways diseases are transmitted are either direct or indirect. Direct, meaning it's spread through direct contact from one person to another. Examples would be kissing, shaking hands, or sexual intercourse. Indirect means of transmission means it's spread through another object. Okay, an example is a vector. Vector is where an animal or an insect transmits a disease. Examples would be mosquitoes that transmit malaria, or West Nile virus, the tick that spreads Rocky Mountain spotted fever, or Lyme disease. Those are all caused by a vector. Modes of entry. How do microorganisms enter and exit the body? Well, through your areas of where things can get in and out. Examples: respiratory tract, you can get it that way, your digestive system, your urinary system, and your reproductive system. Contamination can be stopped by practicing germ control. In other words, hand washing, again, is one of the number one ways of stopping diseases from getting into you or spreading it to someone else, and you shouldn't drink or eat after someone else. The way to control microbes are, how do you do that? Well, things that cause them to spread would be unsanitary conditions, overcrowded conditions, lack of immunizations, and pests. So this is why in most people where we live, we have garbage collection and sanitation. We try not to be in too crowded of an environment, and we are immunized. It's required to have immunizations to be in school, and of course, we do pest control to stop them from spreading diseases. Like, for remember, rats, the fleas that bit the rats that then bit people would cause the spread of the plague. Okay, public health. Public health is where measures are taken to protect the public from possible disease. Things that we do are sewage and garbage disposal, water purification plants, requirements that the FDA has on handling food, and of course pasteurizing milk. These have all made a big impact in preventing infection. Aseptic techniques, ways to kill microorganisms so we don't spread them, to avoid people from becoming septic. Septic means that you were full of poison, because remember, bacteria produce toxins, and toxins are poison. That's usually what causes the problem with certain diseases. Asepsis, of course, it's from medical terminology, means that there aren't any pathogens present. Ways to do that are sterilization, where things are autoclaved, where dry heat, ethylene oxide, where you kill every living thing on an organism. If you go to a nail salon, instruments that are used to do your nails should be autoclaved and sterilized so that it kills any microorganism to stop spreading an infection from one person to another. Also done on surgical instruments as well in the hospital. Disinfection refers to killing all pathogens, but it's harmless to but harmless microorganisms survive. Things like germicides, pesticide applied to non-living surfaces will kill germs but kills the pathogens. Antisepsis prevents further growth of pathogens but doesn't kill them off. Things like bacteriostasis creates a steady state where no bacteria continues to grow, and that is not harmful to living tissue. Standard precautions. You guys should remember this. Standard precautions is whenever you handle body fluid, you should wear gloves. In certain situations, you may also need to wear goggles, a face mask, or a gown. Picture at the top is a dental person having their teeth cleaned. Standard precautions there are to wear gloves and goggles or a face mask. Needles and sharp objects need to go into a sharps container, and you never recap a needle. Linens and supplies should be treated as contaminants once they're used. So as soon as linens and supplies are used in a hospital, they are put in the area where dirty linens go so that they can be cleaned. Hand washing, number one, is the most important thing in standard precautions. After you handle patients, fluids, etc., you should wash your hands. Hand sanitizer is good, but after every 3 times of using hand sanitizer, eventually you need to go wash your hands because you've killed the bacteria, you just haven't washed the dead bacteria bodies off of you. Even when you wear gloves, take your gloves off, you should wash your hands. Basically, when in doubt, wash your hands. Chemotherapy. Chemotherapy, there's basically, from medical terminology, means chemical treatment. There are 2 types, antibiotic and anti-neoplastic. Antibiotic comes from, meaning they do come from a living source, and what they do is they have the ability to stop or kill pathogen growth. Drawbacks of use of antibiotics are that we have developed some resistant strains. So basically 5% of all acute patients in a hospital are there because of a resistant strain of a bacteria. They kill normal flora, and pathogens are able to survive elsewhere, i.e. yeast infection. So it can kill off your normal flora and the pathogen. However, certain antibiotics can cause, most generally women, to develop a yeast infection because it kills off the normal flora that keeps the yeast from proliferating. Hence, you knock out the normal flora, now the yeast kind of have like a party and start growing everywhere. Anti-neoplastic agents are those used to treat cancers. They are toxic to tumor cells and normal cells, and patients become susceptible to opportunistic infections because it's killing off normal cells, and it creates a problem for people to fight off diseases. Ways to identify microorganisms are using dye. Gram stain is the standard method for identifying bacteria. Bacteria either gram positive or gram negative. To identify bacteria or try to isolate pathogens, you would, especially if you work in a lab, you would have specimens of blood, spinal fluid, feces, urine, sputum, and then you would take samples, make a slide, gram stain it, and see what bacteria shows up. You can also swab the nose, ears, eyes, cervix, or any other infected area, smear it on a slide, heat fix it, and then stain it, and then you can see if you have certain types of bacteria. First stain is crystal violet, and if it's gram positive, it's purple. If it's gram negative, it is red because of the saffron, and the alcohol washes off the purple stain if an organism is gram negative. That concludes the presentation for diseases as an overview of diseases and disease-producing organisms. The next 2 slides refer to the credits. Those were of the pictures that were put in this presentation.